Hi students, just checking in here. It's Tuesday, it's Halloween. Oh, happy Halloween. And wanted to just give a little update. I've had a couple of email and phone communications so far, and just want to make sure we're all on the same page. So where you should be in general with your primary and secondary responses, while this class, the nature of this class in personal training, we're really getting a lot of data, gathering a lot of information. So some of it seems very technical, but there's always going to be a question at the end of that technical information that you could very easily respond to. The way that I'm going to grade the courses is that if your flow is that the first week of the module, you want to do all of the primary responses, and then the second week of the module, you'd like to do secondary, that's okay. I will be checking at the end of the second module that all secondary posts and all primary posts are up there. For this module, just looking at what we're saying so far, a few questions that I would like you to consider in your secondary posts, which I started posting to today, but decided that I'm going to put this video out there and then come back to it to see if any of you can kind of figure out what I'm thinking. With the body composition testing, does girth really measure body fat? And that's actually a very important question, because girth and body fat, as a personal trainer, you will use those different measures at different times. So understanding why to use them is fairly critical. So really challenge yourselves and ask the question. Read what your classmates have said. Now ask yourself the question, does girth and does use it as skin fold measurements really both measure body fat? And then the second question that I would ask you is, with skin folds, is the purpose really to measure body fat, or is the purpose to look at fat-free mass? This is very critical, because you may, if skin fold measurements were meant to measure body fat, then of course you could use that in order to determine a change in body fat. If the purpose of it is really to determine lean mass, then you would not then use that for somebody who wanted to lose body fat, but more for somebody who is trying to maintain or increase lean mass. So in your readings, in your research, what is the answer to that question? Really think about it. Don't give me one of these quick answers, oh, it's all body composition. No. What is the difference between skin folds and body fat, and when would be a proper time to use them? And then just the final kind of question, not kind of, sorry, I shouldn't say kind of, but the final question I'd like you to consider in your posts is, these measurements, which ones are really measuring what they say they're measuring, and which ones are departed from that? So when you're measuring heart rate, is it really measuring heart rate? Well, it really is measuring heart rate. You're feeling the pulse that is coming directly from the heart. But there are other measurements we take, the functional capacity test, for example, that it's not a true VO2 test. You don't have a metabolic heart. You're not really measuring VO2. So the question, again, is, what are you really measuring? And is it reliable? So this is the question, is really, is it reliable and is it valid? And so address this when you're addressing these things. Are these things reliable and are they valid? If they are, and how do you increase the reliability? And how do you make it so that they do become valid? So if you're using something to measure VO2 and it's not really measuring VO2, how can it become a valid, reliable measure for you? How could you make that happen? So anyway, just a brief check-in. I will touch base with you guys in a couple more days. If you have any questions, please call me. All right, thank you. Bye.